All right. Thank you, everyone, for tuning in to Tour Tuesday. Today, we're talking with our friends from Children's Home and Aid. So, after our introductory video, we'll go ahead and get started with our conversation. I just noticed the error in my video, but thank you, Amy and Ann, for joining me today. You all want to start off by introducing yourself?
Sure. I'll start. I am Amy Gerardo. I am the program supervisor for the Healthy Families home visiting program here at Children's Home and Aid in DeKalb.
Hi, I'm Anne-Marie Kuda. I'm the program manager and I have two grants. We have a Start Early Doula program here in DeKalb and then an Early Head Start home-based program that serves also doula and children with families from 0 to 3 here in the DeKalb area.
Awesome. Well, just to begin our conversation, do you want to run through all the services that Children Home and Aid provides to DeKalb County?
It's quite a lot. Both of our programs are home-based programs. We come to the family rather than have a center. So how I explain it to parents is we're a center that comes to you once a month, or once a week, sorry. We serve families. Amy, you do 0 to 5?
Yes, we do.
And my program, we serve doula moms, so pregnant moms and their partners. We can take them as early as soon as they are diagnosed that they're pregnant or confirmed that they're pregnant. So 8 weeks is usually the time that we can take them in the Early Head Start program. And then in the Start Early program, we take them a little bit farther along in their pregnancy, but we work with the Healthy Family program here in DeKalb.
Our services, we try to enroll new parents while they are still expecting, because research shows that the earlier we can begin that partnership with parents as they start their parenting journey, the better off that the outcomes are. And as Anne-Marie said, we can stay with those families until that first child is 5 years old.
Oh, awesome. So you provide services from 0 to 5, essentially?
Our home visiting program does, and I
Okay.
know Anne-Marie is yours.
Mine is 0 to 3, but
Okay.
when we get to that 3, we help them find either a center or a school
Okay.
which best fits their needs. So we will help them transition to another program.
Oh, awesome. That's great. So at Kishwaukee United Way, we have 3 impact areas that we focus on: health, education, and financial stability, or meeting the basic needs. Which impact area would you say that your agency most aligns with?
We do our health. The money that we receive from Kishwaukee United Way, we use for diapers and wipes for our parents. We find that it's a hard cost for them. And when we want parents to be changing their children when they need to be changed, not saying, okay, they're only a little wet, we can
Right.
hold on, because
Right.
then other health conditions can set in. So with your grant, we were able to provide all of our parents with a monthly supplies of diapers and wipes for each child that they have in our program.
Oh, that's awesome. I always like to hear the the different impact in the ways that the agencies use the funds, because each agency is different and unique into how that they do that. Amy, I'm sorry for cutting you off.
Oh, no worries. I was just going to say that when I looked at that question, I thought our home visiting program really touches on all three of those areas of impact. I think for our particular program, the biggest one that it aligns with is education. We are, working with parents as far as talking about their child's development, topics like attachment. We do mental health screenings and just kind of open that conversation about good mental health and healthy relationships. We talk a lot about protective factors and how to work with parents to bolster those in their own families. So we do touch on health as well in home visiting because we want to be sure that each family has a medical home, and we talk with parents about well child visits and immunizations, things like that. But I would say the largest area for our program is the education.
Awesome. So how does your partnership with the United Way help you carry out your mission and vision?
I think Anne Marie touched on that with how they're using their grant money. I know that for us, a lot of what we're trying to accomplish takes collaboration with other community agencies. And so the partnership with United Way, through the meetings I've attended and learning of services that a lot of the community partners offer, as well as direct help from United Way. I know we were able to get some of the like the emergency diaper packets and attending the training sessions like the lunch and learn the other day. Just I added that information onto our list of referral sources. I already had 211, but I added some more detailed information that I learned from that meeting.
Awesome.
That's a couple of things from our end.
I think United Way has been, I can't even imagine how many times that we've already used you. We only have so many funds that we can help our families, and our families have really been impacted, like everybody, by the pandemic. Families that have lost everything, can't afford their electric, their rent or anything. So whatever, we use you a lot to refer the 211 to all of our families. It certainly has helped them transverse through this.
Awesome.
But it has been a very difficult time, and a difficult time to start our grant too. So
Yeah.
Having anybody who spreads the word that we're here to help and to enroll families.
Awesome. Awesome. I'm glad to hear that. I think that's one of the things that I'm constantly thinking about is how can we strengthen our partnerships and bring that collaboration piece in. So I'm glad to see that that is being of benefit to you all. Do you have any specific goals or initiatives that you're hoping to accomplish this year that the community can help you kind of carry out?
I know one of our biggest goals just has to do with capacity, both staff and families. So especially with families, with the help of our coordinated intake team member, we have been working on just increasing referrals, the number of community partners that do referrals to our agency, and then just following through with, once we get a referral, engaging that family and trying to get them enrolled if appropriate for our services. And honestly, for my program, we are short-staffed right now. So another goal is filling the 2 vacancies that I have for home visiting positions.
I think everybody has that same problem.
Yep.
Oh my gosh, trying to find staff to hire has been huge. We are a new grant, and we do service 3 counties. We have a capacity of serving 150 participants throughout all 3 counties. And we're nowhere near to where we need to be or where we'd like to be. Spreading the word of knowing that we're here. But again, not only having people know that we're here is, but also hiring our staff. Recently, we also have started a pilot program called Empath, which all of our families do have family goals, and whether it be economic, educational, we want to break that cycle of poverty, that cycle of every family just trying to make ends meet. And so Empath is going to help us allow to break down our goals and to have more of a follow through with our families. We have just started it, so I'm excited to see where that goes too.
Oh, awesome. So I have two kind of follow-up questions to both of your responses. The first one, Amy, you mentioned coordinated intake. Can you just briefly just explain what that is?
Of course, yeah. So our coordinated intake staff person is the designated point of contact, I guess, for that first contact with a new family. So for example, if a referral comes in from the health department, which is one of the agencies that we get a lot of our referrals from, Fanya, our coordinated intake team member, would be the one to kind of receive that referral, document it in our database, make the most of the time make the first outreach contact with that family to kind of go over the eligibility questionnaire that we have. And then she would, using a decision tree that's been developed with a lot of thought and care, decide which of the 3 home visiting programs in our county that family is best suited to. So it's meant to make it as easy as possible for referral partners to make referrals and for families to just have one kind of single point of entry. Did I miss anything on that, Anne Marie, or does that sum it up?
You covered it all. Fanya has been extremely helpful and to making sure that all of our programs are known and help families connect with us.
That's awesome. That seems like a very important position to have, making sure that families get the appropriate program that's going to work and best serve them. So that's awesome. And then Anne-Marie, the impact program, I know you mentioned it's fairly new. Do you collaborate with other agencies for that program? Or is it something that you all are just doing on your own?
Children's Home and Aid has introduced it to several of our programs within Children's Home and Aid. So the
Okay.
Head Start programs have begun with it. We are using it in the central region, so down in Bloomington, our grant, and then the metro region in Chicago.
Okay.
It is a pilot program. We have never used this before, but what we're finding is that we set goals with our families,
Mhm.
and sometimes we don't know how to get there. The biggest one we have is that families have lost their homes and now are renting and they want their homes back. So how do we get them to that point? And we can't just say, okay, save money. We all know
Right.
that.
Right.
So how do we break that down? And what the program does is allow us to break it down into steps. So do we need to, maybe it is that we need a different occupation because the car industry here in Belvedere is closing down. So maybe we need to find education or a new occupation, a training. Can we help with that?
Mhm.
Is it that we just need to help with a resume to get them out there? Is it childcare? That's when 4Cs can help with applying for childcare and affording childcare. What are the reasons for it? And so we try to break it down and as a partnership work with parents instead of having this huge, I want a house, is what are the steps to get back there and help the parents achieve what they want to do. So it is new to us and we are just instituting it. We are excited, a little scared.
Right.
But we're excited because this is a way to have that follow through and help parents be where they want to be.
Yeah, that's awesome. I know a lot of times we can oversimplify things, myself included. It's like, okay, I want to do this, but not really having the I don't know the knowledge to get there. So that's awesome to hear that that's something that you all are starting within your agency. Um, I think we hit all of the questions that I had. Is there anything else that you feel the community should know that they might not know about your agency, or anything you just want them to know moving forward? Maybe how to contact you all for services?
Mhm. Yeah, I mean, I think I want to be sure that anybody that's listening to this in the community, that they know that all of our services are free and they're confidential. And you know, they're strength-based. We know that parents are going to be the experts on their children. We're not there to tell them how to raise their children. We're there to partner with them. It's a journey, right? Parenting has lots of joys, but also lots of challenges. And we are there to listen, to empathize, to share information, to just talk about how they are their children's most important and first teachers, and how do we
Absolutely.
support that, you know, as home visitors. It's also no judgment. I think sometimes parents hear the phrase home visiting and their mind goes to a place of, oh, I better clean my house, or they're going to be, you know, kind of spying on everything I do. And it's really not about that. Of course, safety is always you know, a factor that matters, and we are mandated reporters, but we're really just there to share that experience, to share some evidence-based information, and to celebrate with them. Like Anne Marie said, we work with parents on goal setting too. You know, celebrate with them when they do achieve goals, and when things are going well with their kids, and offer some support and information when there are challenges.
Awesome.
Just like Amy has said, we both use the curriculum called Parents as Teachers. So we believe parents are the first and the best teacher a child will ever have. And our job is to help parents find that and advocate for them, give them the knowledge that they need. Where are their concerns? That's what the curriculum is. What are your concerns? How can we show you an activity that you can do with your child? What are those transitions? Some simple transitions are just a bottle to a cup, or pacifier. Let's wean them off a pacifier, the good old toilet training, all of those milestones through a child's life. We're here to support the parent and make them an advocate for their child, and know that they have a voice, and that they're important, and to give them that, just that support. And you know, as a new mom, I mean, we all get, you know, the first time they put that baby in your arms, you're like, even with my education, I'm like, okay, now what do we do with this child?
Yeah.
You know, so it's just someone to talk to, and we're there for the parents, and it is very rewarding and amazing to see not only that our children grow, but our parents grow.
For sure. I think it's awesome. I think you are providing very important services because, like you said, parents definitely, especially new parents, that support is, I think we kind of, I don't know, I definitely needed it as a young parent myself. So I'm glad that these services are here in our county, and I'm excited to continue our partnership and support the work that you're doing.
Thank you.
Thank you.
Awesome. Well, thank you for joining me today. This has been great, and I look forward to talking with you both soon.
Thank you so much for having
Thanks for
us.
having us, Sheridan. Have a great day.
Have a good one.
Bye.